Thank you. So first, I'd just like to thank the committee for inviting me to present at this very exciting and thought-provoking workshop. So I am going to offer my perspective in relation to three pretty giant questions in 10 minutes. And they are, one, do we know how to help women gain the recommended amounts of weight in pregnancy? Two, are we ready to translate the knowledge into action? And three, what should the future look like? So I'm going to spend most of the time addressing, do we know how to help women gain recommended amounts of weight in pregnancy? And I'm going to address that in a couple different ways. So first, I wanted to share with you results from our Fit for Delivery study, which was a randomized controlled trial to prevent excessive weight gain in pregnant women. We recruited 200 normal weight and 200 overweight and obese pregnant women, and we randomly assigned them within their weight group to either standard care or standard care plus a lifestyle modification treatment program. Our intervention was low intensity, although we did target gestational weight gain, healthy eating, moderate physical activity, behavioral strategies, and motivation. And we did that through one face-to-face visit at our research center at the beginning of the study. And we sent weekly challenge cards in the mail that challenged the women to engage in a different health behavior every week. All the women received 3 brief phone-based counseling sessions and then additional phone intervention if the women were gaining too much or not enough weight. We also sent the women weight gain graphs after each of their regularly scheduled prenatal visits, and so they could see how their weight gain compared to the guidelines. I should say that all these data were collected before the 2009 revision, so they're based on the 1990 guidelines, but we did reanalyze the data with the new guidelines and had the same results. And this is essentially what we found. So the bottom line, before I walk you through the slide, is that the intervention appeared to work in the normal weight women in preventing excessive weight gain, but not in the overweight and obese. So here you can see the normal weight. Do I have my pointer? The normal weight women, 40% of the intervention exceeded guidelines compared with 52% of standard care. But we saw no difference in proportions exceeding the guidelines among the overweight and obese. Of interest was that, so we recruited these women on average at 13 weeks gestation, so they were early in pregnancy. And at that point, 56% of the normal weight and 68% of the overweight and obese were already above the recommended rate of gestational weight gain for that time in pregnancy. And once they exceeded recommendations during pregnancy, few women were able to return to within the guidelines. And we saw that across subgroups of weight status and both in the standard care and intervention groups. When a woman exceeded, only between 3 and 10% were able to get back within recommended rates. And potentially less relevant to today's discussion, but even though our intervention stopped at delivery, we did see positive effects at 6 months postpartum in both the normal weight and the overweight and obese groups. So looking at the proportions who were at their pre-pregnancy weight or less at 6 months postpartum, we saw 35% of the intervention versus 20% of standard care among the normal weight, and you can see 25% of intervention versus 16% of overweight were at their pre-pregnancy weight or below. So in thinking about, do we know how to help women gain the recommended amount of weight during pregnancy, conclusions from Fit for Delivery were that a low-intensity behavioral intervention can prevent excessive gestational weight gain in the normal weight women, but not in the overweight and obese. And the intervention was not very effective in helping women who are exceeding guidelines get back within guidelines. And so we may need some more intensive interventions, both to help the obese women and overweight women in pregnancy, but also help women who are exceeding get back within the guidelines. So I wanted to put results from this study in a broader context. And so here there have been many recent published reviews and meta-analysis summarizing the results of gestational weight gain intervention trials. And you can see the results and the conclusions of these various reviews differ. So with some concluding that lifestyle interventions in pregnancy may be effective, inadequate study quality, effective but inconsistent, no significant effect, effective, inadequate study quality. So I think in asking the question, do we know how to help women gain the recommended amount of weight during pregnancy, you'll get a different answer depending on who you ask. So we thought an important question to ask is, what works to help women manage their weight outside of pregnancy? There's been decades of randomized clinical trials testing interventions to help women manage their weight outside of pregnancy. And so here we summarized the evidence, and you can see here in the largest bubble are strategies that have been shown to be effective in managing weight outside of pregnancy. So we've got effective, moderately effective, and not effective. And I just want to draw your attention to the strategies that are effective. And those include setting calorie goals, prescribing calorie goals, utilizing structured meal plans or meal replacements, weight monitoring, high physical activity, behavioral strategies, and ongoing patient-provider contact. So then what we did is we took these strategies, and I listed them at the top of this table here, and we looked at the randomized clinical trials that have been done testing lifestyle interventions in pregnancy. And those are listed down here, and we rated them to see how the frequency with which they use these strategies. And you can see here, interestingly, that the studies that use these strategies more frequently found positive effects on reducing excessive gestational weight gain. The studies that use these less frequently had mixed effects, and infrequently had no effects. So do we know how to help women gain the recommended amount? I think there is some empirical support from randomized clinical trials that comprehensive programs that include calorie goals, weight monitoring, behavioral strategies, ongoing contact, and moderate physical activity. And for overweight and obese women, programs also include daily diet monitoring. Those programs can be effective in helping prevent excessive weight gain. But there's clearly a lot of more research that needs to be done, and there's a lot of really exciting ongoing research that is being done. I did a look at clinicaltrials.gov, and there are 21 ongoing randomized clinical trials testing different lifestyle interventions in pregnancy. So I think in the next 5 to 6 years, we're going to have some really exciting findings coming out. And some of the studies are looking at how restrictive gestational weight gain goals should be. There's a study testing what happens when you prescribe to an overweight obese woman, and you tell them not to gain any weight during pregnancy. There are studies testing the effects of different calorie goals, use of meal plans and meal replacements in pregnancy, the effects of using internet-based and mobile phone applications, and the effects of lifestyle interventions on the mom, looking at the effects of that on the baby. So more briefly, are we ready to translate knowledge into action? So I learned in my Research Methods 101, right, that efficacy is not effectiveness. So what we study in our research center may not translate, may not be feasible, may not have the same effects in the real world. But on the other hand, and I'll also say most of the emerging and ongoing clinical trials are all efficacy trials. There's not a lot of effectiveness trials that I've been able to find that are ongoing right now. But on the other hand, can we afford to wait? And we've heard some wonderful examples today, and I think we will be hearing some more of programs that are being implemented, available to women to help prevent excessive weight gain. I think there's some wonderful examples. My bottom line and hypothesis is that just as we're seeing in these efficacy trials, the comprehensive programs are the ones that work. I think that to promote effectiveness, we're going to have to see the same thing. I think in the real world, what we're going to find working would be comprehensive programs. What should the future look like? So there could be a lot of things, or many slides to cover this. These are just some of the things that came to the forefront of my mind. And I envision some modification of current prenatal care approaches. One idea, which is not a new idea, is the reversal of the current pattern of prenatal care visits, which tend to be backloaded, where you see the women more frequently towards the end of pregnancy and less frequently in the beginning. And I can envision that more front-loaded, especially in context of those data where you're seeing that once women exceed, it's hard to get them back within the recommendations. So I envision that change in the pattern of visit provision. I could also see overweight and obese women classified as a high-risk pregnancy, and maybe that opening up the door for more intensive and frequent contact. I also don't want to forget those normal weight women. A lot, given the link between excessive weight gain and normal weight women and their later risk of obesity and overweight later in life, I want programs available for them. Most of the ongoing research now is targeting overweight and obese women in pregnancy with good cause and good reason, but I also, again, think that we need to have programs in place to help the normal weight. And of course, to implement these comprehensive programs, as echoing others' thoughts too, we need multidisciplinary training for practitioners and methods to prevent excessive gestational weight gain, and of course, the financial coverage to support such programs. And also echoing other thoughts from today, kind of on the broader perspective, visualizing pregnancy on a continuum and a life course, and intervening preconception during pregnancy, after and beyond. And to do that, of course, would again necessitate practitioner training, multidisciplinary training, and some coverage and financial means to support such programs. That's it. Thanks.